Imagine waking up one morning, glancing in the mirror, and noticing a yellowish tint to your skin and the whites of your eyes. This yellow discoloration, known as jaundice, can be a startling and concerning discovery. While often painless, jaundice serves as a visible warning sign that something might be amiss within your body, specifically with your liver and its intricate system of bile production and flow. Jaundice itself is not a disease but rather a symptom of an underlying condition, and understanding its cause is crucial for effective treatment. One such condition is obstructive jaundice, a potentially serious medical condition that occurs when the normal flow of bile from the liver to the small intestine is obstructed. Bile, a greenish-yellow fluid produced by the liver, plays a crucial role in digesting fats and eliminating waste products from the body. When bile flow is blocked, bilirubin, a yellow pigment present in bile, builds up in the bloodstream, leading to the characteristic yellowing of the skin and eyes seen in jaundice. The severity of jaundice can range from a mild, almost unnoticeable tint to a deep yellow, depending on the degree of obstruction and how long it has been present. While the yellow discoloration itself might not be painful, individuals with obstructive jaundice often experience other symptoms, including dark urine, pale stools, itchy skin, fatigue, abdominal pain, nausea, and vomiting. These symptoms arise from the accumulation of bile and bilirubin in the body and their impact on various bodily functions. Recognizing jaundice and understanding its potential implications is crucial, as early detection and treatment of the underlying cause are essential for preventing complications and ensuring the best possible outcomes. If you or someone you know experiences any signs of jaundice, it is essential to seek medical attention promptly to determine the cause and receive appropriate care. Section 2. Understanding the blockage. Defining obstructive jaundice. Obstructive jaundice, also known as cholestasis, arises when the intricate pathway responsible for transporting bile from the liver to the gallbladder and eventually to the small intestine becomes obstructed. This blockage disrupts the normal flow of bile, leading to a cascade of events that manifest as jaundice and other associated symptoms. To better understand the complexities of obstructive jaundice, it's helpful to distinguish between its two main types: intrahepatic cholestasis and extrahepatic cholestasis. Intrahepatic cholestasis refers to a blockage within the liver itself, affecting the tiny bile ducts that collect and transport bile within the liver. This type of obstruction can arise from various factors, including inflammation, infection, or damage to the liver cells or bile ducts. Certain medications, genetic disorders, and autoimmune diseases, where the body's immune system mistakenly attacks its own liver cells, can also contribute to intrahepatic cholestasis. On the other hand, extrahepatic cholestasis involves a blockage in the bile ducts outside the liver, specifically the common hepatic duct, which carries bile from the liver, and the common bile duct, which carries bile from the liver and gallbladder to the small intestine. This type of obstruction is often caused by physical obstructions, such as gallstones, tumors, or cysts that compress or block the bile ducts. Understanding the location and nature of the obstruction is crucial for determining the underlying cause of obstructive jaundice and guiding treatment decisions. While both intrahepatic and extrahepatic cholestasis can lead to similar symptoms, their causes, diagnostic approaches, and treatment strategies can differ significantly. Therefore, a comprehensive evaluation by a healthcare professional is essential to accurately diagnose the type of obstructive jaundice and develop an individualized treatment plan. Section 3. When bile flow falters. Causes of obstructive jaundice. The causes of obstructive jaundice are as diverse as the human body itself, ranging from common conditions like gallstones to rarer disorders affecting the liver, bile ducts, or nearby organs. Understanding the potential culprits behind this condition is crucial for effective diagnosis and treatment. Let's delve into some of the most frequent causes of both intrahepatic and extrahepatic cholestasis. Intrahepatic cholestasis, characterized by blockage within the liver, can be triggered by a variety of factors. Viral infections, particularly hepatitis A, B, and C, can inflame and damage liver cells, disrupting bile flow. Certain medications, including some antibiotics, steroids, and hormonal therapies, can also interfere with bile production or flow, leading to intrahepatic cholestasis. Autoimmune diseases such as primary biliary cholangitis and primary sclerosing cholangitis cause the body's immune system to attack the bile ducts, leading to inflammation, scarring, and obstruction. Extrahepatic cholestasis, on the other hand, typically arises from physical obstructions outside the liver. Gallstones, small, hardened deposits of digestive fluid that form in the gallbladder, are among the most common causes of extrahepatic cholestasis. When gallstones lodge in the common bile duct, they can block the flow of bile, leading to jaundice and other symptoms. Pancreatic cancer, a malignant tumor that develops in the pancreas, can also compress or invade the common bile duct, obstructing bile flow. Beyond these common causes, several other conditions can contribute to obstructive jaundice. These include benign tumors such as bile duct adenomas, cysts in the liver or bile ducts, and strictures or narrowing of the bile ducts due to injury, inflammation, or surgery. In rare cases, pregnancy can also lead to cholestasis, known as intrahepatic cholestasis of pregnancy, due to hormonal changes that affect bile flow. Identifying the specific cause of obstructive jaundice is essential for tailoring treatment to address the underlying condition and alleviate symptoms. Section 4. Unmasking the culprit, diagnosing obstructive jaundice. Diagnosing obstructive jaundice is like piecing together a puzzle, with each diagnostic tool providing valuable clues to uncover the underlying cause. The journey often begins with a thorough medical history and physical examination, where healthcare providers delve into the patient's symptoms, medical history, family history, medications, and lifestyle factors. This information helps paint a clearer picture of the patient's overall health and potential risk factors for obstructive jaundice. During the physical exam, the doctor will carefully examine the patient's skin and eyes for the characteristic yellow discoloration of jaundice. They will also palpate the abdomen to assess for any tenderness, enlargement of the liver or spleen, or masses that might indicate an obstruction. Blood tests play a crucial role in evaluating liver function and detecting elevated levels of bilirubin, which signal a problem with bile flow. Liver function tests measure the levels of certain enzymes and proteins that reflect the liver's health and ability to perform its functions. Imaging studies are essential for visualizing the liver, gallbladder, bile ducts, and surrounding organs to pinpoint the location and nature of the obstruction. Ultrasound, a non-invasive imaging technique that uses sound waves to create images of internal organs, is often the first-line imaging test for obstructive jaundice. It can detect gallstones, tumors, cysts, and other abnormalities that might be blocking bile flow. If ultrasound results are inconclusive or further evaluation is needed, other imaging tests such as computed tomography, CT scans, or magnetic resonance imaging, MRI, might be recommended. These advanced imaging techniques provide more detailed images of the biliary system, helping to identify subtle abnormalities or complex obstructions. Endoscopic retrograde cholangiopancreatography, ERCP, a specialized procedure that combines endoscopy and X-ray imaging, allows doctors to visualize the bile and pancreatic ducts and perform interventions such as removing gallstones or inserting stents to open blocked ducts. Section 5. Restoring the flow treatment approaches for obstructive jaundice. Treating obstructive jaundice is all about addressing the root cause and restoring the normal flow of bile from the liver to the small intestine. The specific treatment approach depends on the underlying condition, the severity of the obstruction, and the patient's overall health. Treatment options range from conservative measures like watchful waiting to more invasive procedures like surgery. In some cases, particularly when the obstruction is caused by a temporary inflammation or a small gallstone that is expected to pass on its own, watchful waiting might be recommended. This involves closely monitoring the patient's symptoms and liver function tests to ensure the condition resolves independently. Medications might be prescribed to manage symptoms such as itching or nausea, but the focus is on allowing the body to heal naturally. If the obstruction is caused by gallstones, treatment often involves removing the gallbladder, a procedure known as cholecystectomy. This is typically performed laparoscopically using small incisions and specialized instruments, which allows for faster recovery times and less post-operative pain compared to open surgery. In conclusion, understanding obstructive jaundice is crucial for timely diagnosis and effective treatment. By recognizing the symptoms and seeking medical advice, patients can manage their condition and improve their quality of life. But what comes next after treatment? How can patients ensure they live a fulfilling life beyond obstructive jaundice? Recovery and rehabilitation are key steps in regaining normalcy. Post-treatment care often involves regular follow-ups with healthcare providers to monitor liver function and ensure the obstruction does not recur. Patients may also need to adopt lifestyle changes, such as maintaining a balanced diet, staying hydrated, and avoiding substances that can harm the liver like alcohol and certain medications. Support from family, friends, and support groups can make a significant difference in emotional well-being. Engaging in stress-relieving activities like yoga, meditation, or even simple walks in nature can aid in the healing process. Remember, a proactive approach to health, coupled with a positive mindset, can transform the journey beyond obstructive jaundice into one of resilience and empowerment. Stay informed, stay healthy. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more health-related content. Together, we can build a community of well-being and support. Until next time, take care.